Hey, brand builders, ready to take your brand to the next level? I'm Dana Ammons, and welcome to the Brand Blueprint. Hey, brand builders, welcome back to the Brand Blueprint. I'm Dana Ammons, your host, and we're here today to talk about founders that have playbooks that can be turned into practical steps that you can use on your own brand. And one of the founders that I'm really excited to bring the show today is Eric Moyal. And Eric leads Project Insulin, which is a mission-driven effort focused on making insulin access more affordable and reliable. Now, I first met Eric making his pitch actually during the most recent CIC Accelerator demo day. And what stood out to me wasn't just his mission, which I really want to talk about. His mission is so fantastic, but it was the rigor of his plan to scale in one of the most complex and regulated markets on earth. Now, if you're building anything at the intersection of hardware, biotech, or regulated supply chains, this is definitely an interview you don't want to miss. We're going to go deep on go-to-market, manufacturing, scale-ups, partnerships, unit economics, and quality. All of the unsexy pieces that make or break scaling a brand like Eric's. So, Eric, thank you for joining the show today, and I am so glad you are here.
Yeah, thank you, Dana. I'm excited to be here and excited to go into the nitty-gritty.
No, look, before we jump into the nitty-gritty, and I just said some of the unsexy details, but the way you kind of made it sexy, let's talk a little bit or jump into our rapid fire question and answer segment so the crowd can get a chance to know you a little bit better on a personal level.
Sounds good.
All right, let's get started. So, first question we ask every founder on the show, coffee or tea?
I've never had coffee, only tea.
Never had coffee. Okay, wait a minute. This is the first on the show. So first time I've ever interviewed somebody, probably ever talked to somebody directly that, have never had coffee. So explain that or take me down that a little bit more. Where are you from? What is the normal tradition of morning drink? And did you just grow up in a situation where you decided that just wasn't for you?
No, so I'm from Miami, Florida. Cafe Bustelo is what my dad drank every day.
Yeah.
So I know the brand, I know all the stuff. Everyone in my family drinks coffee. We're Middle Eastern, North African, so both tea and coffee are a big part of the culture.
Big part.
But, I think my dad gave me a sip when I was 13 or something, and it was bitter, and I'm a sweet guy. Like, I just want sweet stuff. And so ever since then, I'm just not interested. And now that I run my own business and need a bit of a kick, I am regretting that decision. But if anyone has any tips on ways to get into coffee without dealing with the bitterness, but also not having it be too sweet, please put them in the comments because I need the extra energy.
I love it. Now, from a coffee and tea standpoint, obviously people use it to get their morning routine started. Are you a morning person or a night owl? And do you have something else that you use to get yourself going?
Yeah, I'm definitely not a morning person. I wake up early now. So I do the mornings. I started going to workout classes. Actually, Kat from the CIC, who you've had previously, Kat got me back into spin classes. So I've been going to spin classes.
Shout out to Kat.
Yeah, I've been going to spin classes early in the morning now. So I started doing morning stuff more. But my preference is, I don't want to say night owl because it's not like 2 a.m., but best time for me to be working is 6 p.m. to 10 p.m. Like that's kind of the sweet spot for me. But the way I force myself to exist with everyone else's schedules is I just eat a bowl of cereal every morning. That's always been like, since I was a little kid, a bowl of cereal has always been the thing that just gets me through my morning routine.
Man, okay, so I got to go there since you opened it up. As a cereal connoisseur myself, so what was your favorite brand as a kid? And then what do you still eat the same cereal now? Or have you transitioned to a more adult version of cereal? So tell me what your first brand was.
My favorite brands as a kid were Cookie Crisp, like the chocolate chip cookies. And then I don't know what they call them, but like Eggo waffles.
Yes, I know what you're talking about, the Eggo cereals. Yep.
That stuff was really sweet, but it was really good. I don't eat either of those anymore. I think it's more, what is it? The Frosted Mini Wheats or like Honey Nut Cheerios.
I think that's still in the family though. I mean, you could have went all the way to like granola or mucilix or something, right? Like something really healthy.
Yeah, I mean, at the CIC, they have granola. So sometimes I'll do granola, but personal preference is definitely still shredded mini wheats.
I love that. I love it. I love it. All right. Now, as a founder who is obviously always on the move, kind of constantly looking for new information, new ways, et cetera, tell us about some of your favorite go-to apps or platforms or tools that you kind of use on a day-to-day basis to really make your life as a founder, much easier.
Yeah, I think for me specifically, again, I'm not a technical founder, so I don't have that. I'm not subscribed to Science Journal Daily or whatever the science stuff is, but it's just LinkedIn. I use LinkedIn all day long.
I love that.
It's just the space to meet people, reach out to new people. A lot of my outreach is just on LinkedIn. Otherwise, I only use the internet to procrastinate.
I love it. I love it.
And then Gmail. Other than that, I guess HubSpot. I really like Monday, actually. I don't know if you use Monday at all.
Yeah, I love Monday. I've used Monday. I would tell you two things about Monday. And for our audience, it is a project management CRM kind of platform that really serves, if you use it correctly, as an all-purpose tracker of everything important that you're working on the business. And it allows you to share and bring multiple parties in, which is a really critical component of it. You can see tasks, share subtasks, etc. And I think the biggest challenge for me is really just being disciplined enough to use it and integrate it in every single thing I do. I'm a bit of an old school guy. I started with the Franklin Covey planner system. For those of you out there who still use the manual planner system, I used that for probably 15, 17, 18 years of my career before technology finally caught up and everything went more digital. And so the first 20 plus years of my career, I carried a leather planner around, 3-ring binder. I punched holes in it, right? I wrote my to-dos down. And so now I'm slowly transitioning into pushing most of my to-dos into Monday. But I agree. It's a fantastic tool. I wanted to circle back though and have you, Eric, give a little bit of additional advice, because as founders, I find a bit of a challenge in terms of how some founders are using LinkedIn. And I know in a lot of content and a lot of podcasts, founders will hear, oh yeah, I'm always on LinkedIn. I use it as it's kind of where I stay. How are you using it, Eric, on a day-to-day basis? Are you scrolling through, replying, randomly interacting and engaging with different content? Tell the people a little bit more about how you feel like you're effectively using LinkedIn.
Yeah, I post on there when something cool happens, like the updates. I'll post if something like really bad, but like not personal happens too. I try to it's hard, right? Because it's always like, oh, look at how amazing everyone's doing all the time, right? Like all social media. Thankfully, nothing really bad's happened recently. So not a lot of those recently, but more specifically, my LinkedIn usage is like, I catch up on the people I know who are also entrepreneurs, right? Like you just meet, like a lot of your network becomes entrepreneurs. So it's like always cool to see what someone else is doing. So I do scroll a little bit and like just to get a general sense of, oh, hey, I saw your LinkedIn post a few weeks ago. Congrats on XYZ. But mostly I use it to do research. Like I'll tell you, like for me, the perfect example is early on, right? So I run a medical nonprofit essentially, and I'm a professional fundraiser, right? I don't have that background in life sciences that you would normally have if you started up your own company. And so I typed in insulin and then found 100 people and reached out to each of them being like, hey, I'm trying to do this thing. What do you know? And can you help me? And then it was like, okay, at the end of those conversations, it'd be like, okay, what should I be like? Who should I be talking to? I don't need a name, but like, what is the title of someone I should be talking to? And I would just type that title in, and then I would reach out to those people. And so I still do that now. We're scaling, and marketing and PR are things that I need help with right now. So I went a different route this time. I went with university alumni, like from my alma mater, who are marketing and PR people. And I was like, great.
And what was your alma mater?
Brandeis University.
Shout out to Brandeis University Alumni Network out there helping Eric make things happen. And I think it's so important, Eric, to mention that. The reason I wanted you to bring that to the surface and really talk about it in more detail is because founders, I think, struggle with understanding how to transition out of that TikTok, Facebook, Instagram mindset in engagement and into LinkedIn, which is a completely different type and level of engagement. And founders, if you're listening to Eric's examples, listening to my examples, you can go out, number one, on LinkedIn, find Eric Moyal, find Dana Ammon, send us an invite, and you can get a feel for how we engage our followers and our connections on LinkedIn. And I would tell you one of the key things that I think you said there, Eric, that I found very relevant is number one, remember that LinkedIn is a business environment from a networking standpoint, right? And so you may have some personal things going on in your life, some things you want to share, bad and good. New baby, just recently got back from a great concert, listening, to Taylor Swift, et cetera, et cetera. That's probably more suited for your Instagram, TikTok, and your Facebook crowd than it is for your LinkedIn crowd, right? And so I think that was one thing I really appreciate you bringing up and really talking about a little bit more. Now, before we get off the rapid fire question and answer segment, I wanted to go to one other area because you mentioned something, and I think it was really important in terms of probably intimidating to some founders, but you obviously have a lot of experience in it, and that is fundraising. And you specifically said, I'm a professional fundraiser. So tell our audience a little bit about what the difference is, right, between professional fundraising and just you're out there asking for money.
No, so this isn't like going to private equity and VC firms. I'm not a professional equity fundraiser. This is nonprofit fundraising where if you went to university, you get these calls every year where someone's like, hey, Dana, did you go to university?
Yeah, I went to Morehouse College. Yep. And they definitely called to remind me of my obligation.
Yeah, like Dana, you got a great time. You look really snazzy. It looks like you're a successful person these days. Don't forget Morehouse. Yep. So that was my job. So originally I did the phone call, like the phone bank. I was the manager at the phone bank. And then I had my own portfolio of alumni. So, if I had the Boston area as my region, I was at Morehouse College, I would be like, hey, Dana, let's get lunch. And then we would go out for lunch. I would kind of poke and prod and figure out what it was that you loved about Morehouse. And then I would tell you well, actually, we're trying to build a new stadium, or we're trying to build a new arts facility, or funny enough, we want to start podcasting as a opportunity for students. Can you give us X dollars? And then, so that's what I mean by professional fundraising. I mean, nonprofit fundraising. It's a little different when you're doing a startup because you don't have the database or the years of alumni and the camaraderie that comes with that and stuff. But it's the same principles, just executed differently.
And Eric, how did you get into that? Was that something that you just naturally kind of gravitated to after school, or did you get kind of pulled into it? What was the background?
Yeah, so my goals in college were to be in sports management. So I worked for the Patriots as a game day associate. I was if anyone's familiar with Major League Lacrosse, I was the Boston Cannon mascot for a day.
Wow.
Probably my favorite fun fact.
Yeah.
I was the mascot for a day. I worked for a couple basketball teams. So I did it. I did all of it in college. But funny enough, I got a scholarship to go to Brandeis, and in the summer between my junior and senior year, I was doing a catering job. And so one of the events was the alumni weekend at Brandeis. And I had previously met the lady who was the professional fundraiser who had my donor in her portfolio. And so that lady was at the alumni weekend and was like, hey, what are you doing here? I was like, well, the scholarship helped, but I still I need to eat and rent and all these other things. And so she was like, oh, do you need a job generally? I was like, yeah, I'd love to have another job on campus. And so fast forward to the fall, and she was pregnant and getting ready to have a baby. And she was like, I need extra support. Can you come in as my part-time coordinator? So that's how I entered the office. I wanted to keep it short. I ended up, they were like, okay, well, now we need a student manager for the phone bank. And then when I graduated, they were like, well, we want a young alumni to do young alumni fundraising. And so then I did that. And then that was kind of,
wow.
So it wasn't,
that was the start of, right. It clearly shows something, Eric, that you have a history of not being shy and opening up your mouth and asking for help or asking questions when you see the need, right? And I love that quality. I grew up in a similar kind of environment and household. My mom used to always say a closed mouth never gets fed. Yep. Right? She'd always say, if you want something, you better say something. Because if you don't say anything, people don't know, right? And you clearly have developed that same kind of spirit, which you've carried into your business, which we're going to talk about now and get ready to transition too. So Eric, thanks again for sharing a little bit of your personal life in our rapid fire question and answer segment. But are you ready now to jump into the meat and potatoes of the interview?
More, let's do it.
All right, great. Let's jump into it. All right, Eric, look, I have been waiting to ask this question since I first heard you in front of the pitch event doing such a fantastic job, which, by the way, audience, I wish I could give a full-length photo. Maybe I'll find it in my photo folder on my phone. But this young man came to impress at this pitch event. Full-length linen suit, ponytail in effect. When I say this guy was one of the slickest and most prepared, most debonair presenter and founders I have had a chance to see or hear listen over the last couple of years, this was definitely Eric. So Eric, first of all, shout out to you for not just coming with the passion, which we'll talk about in a little bit, but you came with clear passion, but also you dressed for the occasion. And I am, as a fellow male fashion follower, I am very much appreciative when I see guys put that extra effort in. So tell us a little bit about your origin story. We know now a little bit about your professional life and how you got into fundraising and what you did in school. But let's go back a little bit farther and tell me about how and why your background led you to this moment of being passionate about solving this insulin crisis.
Yeah, it's an interesting question. People have asked me, like, have you always been an entrepreneur? And I've always been like, I don't really know what that means. Like, it's like when I had a problem, I tried to solve it. And so, like, the only clear example to me was like in 8th grade, we had a trip to Washington, D.C. And I was like, okay, well, I have to like raise money to go do that. And so I went to Costco, bought like a variety pack of chocolates, and like I had my own little box, and I would like go around the school, and I was a chocolate guy for like a few months, and everyone got $1 chocolates. You buy the box for like $6. $1 chocolates, it's like $25 in profit every box. It's a good time. So I think that's like the most specifically entrepreneur thing I've done. But like I mentioned, I worked in college always. I worked in high school, I worked in college. Towards the end of my college career, I was working 40 plus hours a week. And the reason was, unfortunately, at some point in college, my sister got into an accident where she ended up being diagnosed with a couple of rare chronic illnesses. And so I was working to, I don't want to say fully support her, because there's no way, but I was partially supporting her through, the extra hours I was doing and the summer work that I did and all that kind of stuff. So,
older sister, younger sister?
Younger sister.
Younger sister.
So she was still in high school, and so again, from Miami. So we were far apart too. So it's not like I was getting a full sense of what was going on.
Yeah.
I wasn't there. So it was all, I'd come home for winter break and I would see her and be like, oh, we used to play basketball a lot together, and she couldn't play basketball anymore. And like, we used to play 2K, again, basketball, just anything basketball related. But we couldn't play that anymore because it was a neurodegenerative illness that like took away her ability to use her right arm. And so through that, I learned about issues with healthcare. It took 2+ years to get her diagnosed. I learned about how expensive medications were. All of her medications were not covered by insurance. Right. The doctors she needed to go to were specialists that weren't in Florida, because Florida is not a good state.
So everything was out of network, not covered by network.
Right. So everything's like, right. So I learned about the healthcare burden and the costs of healthcare at that point at 20 years old. And so I would say that's the spark, right? Like, but that's not when I started this, right? So like, pin that, right? So that happened in my life and continued being a thing. And I was raising money and awareness for this illness. And I did a bike ride from Boston to Miami, where I like stayed with people who have the illness, and we like met them and learned about like their lives, their perspectives. And it was really, it's a whole different podcast, but
really, it is a whole different podcast talking about that illness as well. But man, an incredible gesture. You did a bike ride from Boston to Miami. How many weeks did that take? Even because obviously you stopped in each of these homes, stayed with people, etc. How long did that take?
So I had 18 vacation days to use. So it took 18 days.
No way.
It was 16 days to get down to Miami and then 2 days to drive back up.
Wow, Eric. That was amazing. And then, just out of curiosity, in the sum total of what you were able to accomplish, what it is, the end result ended up looking like.
Yeah, we raised about $7,000 for the organization. This was like my first time fundraising on my own. So
Yeah.
I learned a lot from that. But like it led to a TEDx talk that I gave about the illness. And I think that probably had a bigger effect on, spreading the word. Because again, it took 2 years to get her diagnosis because people didn't know what her illness is. They didn't understand that and I guess I'd be not a very good ambassador here if I don't. It's called complex regional pain syndrome, shortened for CRPS, and then thoracic outlet syndrome, or TOS. TOS is more common in athletes. CRPS is the neurodegenerative one where your nerves stop working the way they're supposed to.
So CRPS and TOAS?
TOS.
Oh, TOS.
So if you follow basketball, again, my
I do.
biggest thread, Markelle Fultz. Remember how before his rookie year he got into like a motorcycle accident or something? And then he got diagnosed with thoracic outlet syndrome.
Okay. I remember him having like this extended recovery time frame, et cetera, that kept him out that following season, I think, or
exactly.
Next season.
Exactly. Okay. That's TOS. And then that's also why like he was having such problems with his shot afterwards. Because it's a compression in your ribs. Well, I guess like here. And hold on, let me just finish this.
Yeah. And you get this is not a affliction or a disease that is genetic in origin, right? This is something that can happen to you after an accident.
Yeah, so CRPS is normally after an accident. It could be something as small as an ankle sprain. Again, there might be, they don't know. This is like another issue is there's no research into this. So there might be like a genetic disposition to getting it, but
no research to really understand that.
That's like one of the reasons we did the fundraising was awareness plus you need to do research and other things. So I'm actually on the board of a nonprofit for this. So I did the bike ride and then ended up joining on the board for the CRPS organization. It's called RSDSA. Check them out, RSDSA, rsds.org.
And definitely check that out, audience. We will put all of these organizations on www.theblueprint.biz, not .com, because we're about that biz. But make sure when you check out the show notes for this show under Eric's biography on our website, we will include some of these additional organizations because to Eric's point, he is probably a part 1 and part 2 interview. And obviously we came in today to talk about his most current and recent project. But however, I do believe this deserves a little bit more of a deep dive and further discussion in a part 2, Eric. So if you're willing to come back at some point, I would love, man, to go a little deeper on this particular disease and affliction, especially as a person who's not only a basketball fan, former athlete, family of athletes and basketball players. Both of my brothers played basketball in college. One of my brothers played semi-pro basketball for 13 years in Europe and spends his retirement years training young basketball players in California. Shout out to Andre Woolridge and shout out to Ron Thompson, my youngest baby brother, who was a center in college for Prairie View A&M. He started off college at 6'2" and was one of those few people who kept growing after he went to college. So he made it to 6'8". He did 6 more inches in college, started off as a small guard, left as a center. So basketball is definitely part of my life, but more importantly, it sounds like you are doing something that is really, I think, important, which is exposing and driving awareness to clearly an understudied and underappreciated affliction that many of our fellow citizens are going through, and especially your sister as well. So I really appreciate, man, your dedication to just jumping in there and figuring out a way to try to help, even if it was a splash in the bucket, so to speak. Yeah. That was a huge gesture to go from one end of the country to the other on bikes. So we definitely got to talk about that. I also love the bike ride. So we got probably a third conversation to have around what that was even like. But let's talk a little bit more about the key subject we're talking about today. So talk to me about it. Tell me about how then this, what I think is really an innovative approach to driving insulin availability. Like, how did you get to insulin as a inspiration of another problem you wanted to solve? Because you clearly are a guy who likes to solve problems. How did insulin become one that you wanted to solve?
So yeah, the reason we brought up the whole bike ride and my sister's illness was to get to this part of the story. So that's all like my background, right? Learning about my sister, the accident, bike rides, all that stuff. Then in 2020, I met my partner and she has type 1 diabetes. And so one of my biggest frustrations with my sister's illness is that like as a fundraiser, I can't really drive change, right? That's kind of a research issue. It's
Yeah.
not an issue that can be solved by just raising money. But I met my partner. She has type 1 diabetes. And, within 8, 9 months of our relationship starting, I made a post on Diabetes Awareness Month, because I was trying to be supportive and like learning about her illness and et cetera. And so I wrote something in that post that said, and insulin continues to get updated and is like, there's always new stuff happening. That was part of my post. And her sister screenshots it and sends it to my partner and says, hey, he got this wrong. And I was like, oh no, like, like I didn't do enough research. I just kind of thought I had a gist. And so she explained to me that no, it's been the same insulins for like 30 years. Now, my grandpa had type 2 diabetes. So I remember
As did mine.
so
As
I
did
remember
mine.
him like taking the shots. And I was like,
Yep.
wait,
Every morning.
that insulin from like 20 years ago is the same insulin you're using today, and it's only gotten more expensive.
Yeah.
And so I was like, there's no way the patents for this haven't expired yet. So that was kind of the impetus, right? It's like, I know about expensive drugs. I know about how hard it is to get diagnoses. I know about how hard it is and how frustrating it is to get doctor's appointment and all these other things. And finally, I found a thing where it was like, the patent for these drugs have expired. People know, smart scientists know how to make insulin. It's not like a secret recipe.
Yep.
This isn't like, the secret sauce for KFC or whatever, right? This is something that everyone in the field knows how to make. And so to me, finally, there was a healthcare problem that wasn't a science problem. It was a money problem. It was a problem that could be solved through fundraising. We raise the money, we hire the team, they make the insulin, and then we can sell it at whatever price we want. And as a nonprofit, we're not forced to make it expensive because we're not pressured by shareholders who need a return on their investments. That's the deal, right? The deal is I give you money today, and tomorrow you give me profits. The deal with me is if you give me money today, I am going to make insulin more affordable. That is the unwritten deal of the investment, right? So that is how Project Insulin started. And so 33 minutes into the conversation, Project Insulin is a nonprofit making its own generic insulin that will sell directly to patients at cost, regardless of insurance status. So it'll be one flat rate for everybody, and we'll sell it either through our website, so projectinsulin.org/pharmacy, not ready yet, don't go there, or through partnerships with local and federal healthcare clinics, because it's not just about affordability, it's also about accessibility, right? Like not everyone knows who we are. Not everyone has a home address. Not everyone has access to regular internet. And some people just go to clinics and get their insulin there. So affordability, sell it directly to patients. Accessibility, partner with the places where people are already going to ensure that everyone has access to the insulin they need.
Wow. And Eric, phenomenal multifaceted approach to distribution. Tell me a little bit more why that model is more important, because typically right now, right, founders are listening to this, even though you're in the nonprofit space, this feels and very much is a startup, right? Yep. And in a lot of startup, call it advice now, there's a lot of noise around D2C and just focusing on D2C and not going to retail real quick and not going to distributors and wholesale partners, et cetera. And you've actually taken the exact opposite approach, which is a multifaceted partnership distribution, including retail, where you can find it, a partnership. So talk a little bit more about, as a founder, why you got to that multifaceted strategy and why not just D2C and just direct to consumer and cutting out all these additional middlemen, so to speak.
Yeah, so it's interesting. In normal for-profit or normal startups, that might be the norm. But in pharmaceuticals, the norm, like I'm actually cutting down the middlemen, right? Like I'm cutting out insurance companies and wholesalers and pharmacy benefit managers, and all these other we cut it to 2 or 3, right? Like that's cutting from 9 interactions to 2 to 3. So I wouldn't give this advice to every startup founder because it's not the same, right? Like this is specifically for a nonprofit life sciences company. And I do think that mail order pharmacy is becoming more prevalent in life sciences generally. So I think we're going to be lucky that by the time we have our drug come out in 5 to 8 years, it won't really be like this cutting edge new way that drugs are distributed. like Amazon Pharmacy is doing it. Mark Cuban's Cost Plus Drugs, they do this kind of stuff. So, and obviously there are other smaller versions as well. So in my world, I'm cutting, I'm not adding middlemen. So that is kind of part of why the price is going to be cheaper as well, is because we're getting rid of insurance companies and pharmacy benefit managers and wholesalers, and even the manufacturer, who's a for-profit manufacturer, the price is already higher than it will be for us because our baseline is covering our costs, not making 20x, 10x, whatever it might be. So I wouldn't give advice on distribution to others. What I would do, or to give the advice, would be go talk to people in the field, right? This is like the LinkedIn piece, right? To me, I only learned about all this stuff because I asked people and people told me, right? Like a closed mouth doesn't get fed. If I don't know something, I go to LinkedIn and I'm like, hey, can you help me?
But I mean, and this was a very complex category. You even mentioned earlier, as you were answering that question, the length of time that you anticipate it will take for you to come to market with a finished product. Talk a little bit about that. And if you can, demystify for the common, non-pharmaceutical person, why did it take so long? And to your point, the patent had already expired. This should have been something, or you would have thought somebody else, bigger company, would have already taken this space and innovated. So tell us a little bit about like the process of innovating a drug that's already been, created for 30 plus years over, and then why it takes so long then to come out with this newer version that you and your team are working on.
Yeah. So first, it's not even a new version. It's like, Tylenol versus acetaminophen. I think that's the right, whatever. If I got it wrong, don't flame me. It's fine.
Yeah, you got it right.
Tylenol versus the generic, right? Like you go to CVS, you get the generic version, and it's the same drug. It's just not brand name. That's what we're doing. We're creating the non-brand name of the long-acting insulin. So this is the insulin that both of our grandpas would have taken. It's the long-acting. You take it once or twice a day. The reason we picked it is because it helps type 2 and type 1 diabetes. It's for the largest common population. That was our goal, was to help the most people right away. It's a 5 to 8 year process because we have to raise like $20 to $30 million. So it's not necessarily scientifically, it's not a 5 to 8.
Some of it's financial driven.
It's a financially driven, so if I know Jeff Bezos listens to the podcast. So Jeff, if you're listening, book 20 to 30 million, and then our timeline becomes 3 to 5 years instead of 5 to 8, right? That's a big difference, right? That's the end of the decade versus halfway into.
Now, but I mean, that's even an important thing you just said there. Even with the money right now, if you had it in your pocket today, 30 million, you still got another 3-4 years of runway before you can take off. So tell us a little bit about, financial considerations will get you 2 to 3 years of that process. Now, what is the rest of the process?
Yeah. So what is actually happening is we're creating. Insulin is made of a living organism. It's a biologic drug. So it's made of, the one that we're making is through E. coli, right? So that's a living organism. And it's the reason why it's called a biosimilar, not a generic, is because it's not exactly the same, because no two living organisms are exactly the same. And so you still have to go and create your own strain of insulin, right? So even though it's going to work similarly, biosimilarly, it won't be exactly the same. So you do have to go through the testing to make sure that it's not poisonous, make sure that you can inject it into people, make sure that once you inject it into people.
Clinical trial, is that part of the process?
Yeah, so there's creation, like creating the drug itself. Then there's preclinical trials, making sure that it's stable, making sure that it's not toxicology, all these other things. Then there's scale up, right? So you have to go from, a small pipette all the way to 250 liters to 3,000 liters to 10,000 liters, right? These are massive scaling operations that have to be done. And so that's actually probably the most complicated piece, is scale up. But there's that needs to be done. And then finally, there's like your clinical trials where you actually put it in people and make sure that it works, again, biosimilarly to the original product, because it can't be a generic version if it doesn't work, plus or minus to the actual product.
No, it's amazing. So, and once you go through clinical trials with a product like this, pharmaceutical wise, I'm assuming that would then set you up not just for sales in the US market, but from a global standpoint, or would you still need to go through multiple, again, regulatory processes for those other countries?
So you would have to go, some countries just take FDA. Some countries don't. So obviously Europe has their own version of it. India has their own version of it. Some African countries have their own versions, but some of them are also like, it wouldn't be the whole process all over again. It would just be like a continuing study. So we would bring the finished product to those places and then kind of do like an add-on study basically instead of doing a full new. So that process would be shorter than the original drug creation, but it still might take a few years.
Wow. Okay. Now, tell us a little bit more about your specific company vision then as you scale and come online. Is this a product that you envision would replace a lot of the pharmaceutical provided insulin that's at a higher price and et cetera now? So do you see, essentially from a market share standpoint, you would gain share from these larger competitors that are currently, essentially price gouging in many cases? Do you anticipate that those competitors will come down in pricing to try to block you out? Like, what's your perspective on, kind of your ability to scale once you're ready to go and you've got that 500 milliliters in the tank and ready to pop out?
Yeah. So it's not, well, I'll say this. Our target market is the 1.3 million Americans who currently ration their insulin. So that is 1.3 million Americans who don't take as much insulin as they're supposed to, which leads to like an enormous amount of, complications, diabetes-related complications, amputation, glaucoma, heart issues, cardiac issues, so many different complications. 1 in 4 healthcare dollars is spent on diabetes in the United States, and a lot of that is complications. And so that's who we're targeting. We're targeting like the people who can't afford their insulin today. So are we going to be taking market share? Probably a little bit, right? Like some people will see that our insulin is cheaper than what they're paying with insurance. But realistically, that's not our goal. Like, yeah, I mean, the more people who have affordable insulin, the better. But people with good insurance don't pay that much for insulin, right? Like how insurance works for some people. That's not who we're targeting. We're targeting the people who are uninsured or underinsured, right? You might have insurance, but still can't afford your insulin. And then to me, kind of long term, it's also those people who can't afford their insulin, but are sacrificing better food, better education, moving to a better job that doesn't have as good insurance, but is a better quality of life for you, not being stressed about turning 26 and getting off your parents' insurance, and suddenly having this massive expense added on to your
life. Yeah.
Right. Yeah. And so to me, it's like 1.3 million plus, right? So it's really probably like 2 million people, maybe a little bit more than that in the United States. That's our first goal, right? Is to get to those people. And do I see the big pharma companies coming after us? Not really. I mean, like they're moving on to the Ozempics and the Wegovys and all these GLP-1 drugs. I mean, I can talk about this for sure. There's insulin shortages happening across the country today. Like I got an email from a friend who works at a hospital, and the hospital was like, listen, we only have 1 or 2 weeks left of this long-acting insulin, and we don't know what we're going to do because we're going to have shortages through the end of September. That's something that we can alleviate. That's also meaning that these hospitals don't have access because the manufacturers are cutting down the supply because they're focusing on a drug that they make a whole lot more money on than they do on insulin. And so, I think like.
So supply is being throttled by the major producers so they can shift their focus and obviously capacity to other drugs that make them more money.
Exactly. Yeah.
Wow.
And again, that's a shareholder thing, right? Like shareholders demand profits. And so if you have a fiduciary duty to shareholders to make as much money as possible, why on earth are you spending your manufacturing space on a drug that doesn't make you as much as the other one does?
And do you anticipate, Eric, that the combination of like regulatory, supply chain, and legal, call it requirements, are going to complicate your ability to deliver that product to the right constituency? Because I come from that audience. I grew up, I think both of us share that history of having grandfathers who were diabetic. And I watched, similar to you, my grandfather every morning at the breakfast table. I remember vividly as a kid being fascinated by the fact that my grandfather could take a syringe and stick himself, which, at that age and stage, I was terrified of needles.
Yeah.
terrified of anything that looked like a doctor, right, sticking something into you. And here my grandfather was every morning at the breakfast table, he would just slide back after he finished his plate of eggs and bacon and literally roll his jeans leg down and pull his syringe out and give himself his daily shot. And so I remember also though distinctly knowing that the cost of that insulin was a very real expense for my grandparents, right? And over the years, I've had multiple family members who I know have, because of expenses, personal and otherwise, have rationed or decided to not take their insulin for periods of time, et cetera, because they just didn't have the money. And I'm curious as to how your product is going to reach that audience. How do you, as a founder of a nonprofit, drive the awareness even in that audience to say, hey, you're underinsured or non-insured, but there are some cheaper options? How do you partner with the right organizations and drive the right awareness around the availability of your product?
Yeah, so that's a huge question. It's something that we're working on all the time. Thankfully, we just have time. Like we have 5 to 8 years. We're on podcasts like this one. We're on,
Yeah.
like, we're just building the organization. So we're meeting more people. We're understanding things as we grow. Again, partnerships with local and federal healthcare clinics. The VA would be an amazing partnership to have. We're partnering, or like we're already talking to federally qualified health clinics. We have volunteers who work at these clinics. And so there's that piece as well, right? Like, but like, long-term vision, free health screening days, right? We'll do free health screening days where people can come in, get their eyes tested, their feet tested, their dental exam, and just like provide them with information and resources and opportunity. The American Diabetes Association does a really good job at that. And
Nice.
so, right, it's like partnering with the organizations that already do stuff. We're not reinventing the wheel. When we just hired our chief scientific officer, and I told her, I was like, hey, this is going to be pretty boring science-wise. Like, you're not making something new, right? We're just doing something that already exists. You're not doing this. This job isn't for you if you're trying to like make an innovation scientifically. But if what you want to do is make real tangible impacts in a few years, then this is the right job. And so she was like, yeah, I'm all in. That sounds amazing, which was really cool for us. But yeah, we're going to try to partner with as many. Again, we're a nonprofit. We're like, that's the whole point. It's like, we're supposed to partner with people and meet people and see who's doing what already and how do we help them. I mean, there's a clinic in New York that sent us an email recently being like, hey, we don't have enough insulin. Can you help us? And it's like, no, but one day we will. And hopefully in the meantime, we'll introduce you to a couple of people that we know.
Wow. No, that's amazing. So, I mean, there's so many things, obviously, that you have to accomplish over the next 4 or 5 years in order for this to be successful. If you were to give our audience just a basic roadmap, and I know it's much more complicated than what I'm asking you to do, but just envision, right? Because it feels, anytime I think you hear founders talk about objectives that they are focused on accomplishing that are literally 3, 4, 5 years away, for some that are not engaged in the mission, it can feel a bit nebulous, right? A bit ethereal, like, oh, is he really going, I don't know. It's like, walk us through, Eric, like, how do you stay focused and what's your timeline and time track, right? Like, what do your next 12 months look like, so to speak, so that you can kind of crystallize for our audience as a founder, how you stay focused on getting to that 5-year objective, which could feel so far away.
Yeah, it's a interesting question. I don't know if I have a really good answer, but I'll try. As far as staying focused, I can give you the timelines. That's fine.
Yeah.
So I'll start with the timelines. Next 3 months, drug development starts. That's the goal. Like, we have the proposals from different drug developers. We have the chief scientific officer join the team last week. This is in August, so last week relative to what we're talking. And that's the shortest term goal, start drug development. 6-month goal, we need to raise $750,000 to $1 million to do the next stage of drug development. So we're already preparing for that piece. 3-year goal, raise $5 million, get to the next stage of drug development, right? So that it's nice because we do have it's like pretty simple.
Clear milestone.
I know what I need and I know how much it's going to cost.
Yeah.
How do you stay focused and into it? I mean, it's a hard question. A lot of people come up to me and say like, hey, you've been doing this for a long time. Like, what have you done until now? It's like, yeah, like it takes a long time to learn about drug development and like understand how to make a drug and like build a company and infrastructure and all these other things so that you can even get a chief scientific officer to say, oh yeah, this is a real company. This isn't like a waste of 6 months of my life or, the next 5 years of my life. I'm joining this because I see that future. I see that vision. And I see all the work that you've prepared. So how do you stay focused on it? Like, don't get into it if you know this is a long process. Don't get in if you're not incredibly passionate about it. Before we started, I mean, the first, what would it be like 5 months, maybe 6 months was just me like, okay, am I actually going to do this? Do I really care about this enough? Like, if I wasn't dating my partner, like if we broke up, would I still want
Would you still be passionate? Correct.
Like, is this like a, savior complex type thing or romantic superhero thing? Or is this like something I really actually care about? Yeah. That was like it was like the first question my therapist asked me. I told him about this. He was like, hold on, like, are you doing this for you or are you doing this for somebody else? And, the answer ended up being I was doing it for me, but like, you have to have that conversation with yourself and you have to have those.
You got to answer the why question.
Yeah.
You got to answer the why question, right?
This is a 10 plus year, like I started this in 2021.
Yep.
5 to 8 years from now is like 2032. That's a 10-year, like that's 11 years of my life I'm committing just to get.
That's a crusade at that point.
Right? Yeah. So yeah, like how do you stay organized and stay passionate about it? You have to do that work when you start. Like staying organized and passionate about it now is like, there's a company now. It's exciting now, right? Like we doubled our workforce, right? We went from 1 to 2. Like, and so to me now, it's like we're doing the fun stuff. I'm going to go out and actually try to raise $1 million, and I'm starting to meet millionaires and multimillionaires. It's like, oh shit, like we're getting there. But the hard work was earlier. Like, and now it's hard work because we're doing the actual job. Back then, it was hard work because it's like, how do we even get to today?
But I mean, Eric, you did a phenomenal job of kind of planning, thinking it through, taking a really good amount of time early on before you ever broke ground, so to really decide and commit to the idea. What were, if any, some of the things that you now look back at and wish you would have known beforehand, right? Like you did a lot of things right. What were a couple of things that you were like, man, wish I would have known that on the front end, but if I was advising the founder now, don't do it this way, do it this way?
I think, I don't know if I had the resource for this, but I needed a technical founder. Not technical in the like coding, like like the person I just hired, the chief scientific officer. I think that would have really expedited things, but it's hard because there's no equity. So you can't just like, I just hired someone who's had 30 plus years of experience and 20 plus years at Merck. You don't get that person when you were, just starting off and not sure. So
correct.
I'm not sure if that actually is a feasible piece of advice or not.
No. Let's frame it this way then, Eric, because I think it is in this sense. How would you rate or rank hiring the right employee versus making the right partnership, right? Because you've done a really good job of both. And early on, to your point, you were an operation of one, and you were out there on LinkedIn primarily, making relationships and partnerships and connections happen. Which one would you say would you rank first? Because both are important, but which one would you have ranked first? Would you put more energy in making that right first hire? Or would you have put more energy in staying into the networking that you did?
Yeah, I think the networking foundation is going to lead to this hire thriving much more than if we had hired her first, or whatever, someone like her, and then been like, oh, I hired you, but I actually don't know what I need you for. I just know that I need you. And like now, I would have done it the same way. I think it's more knowledge. Like what I would have done differently is like I would have implanted what I know today. If I knew what I know today 4 years ago, it would have taken 2 years. It would have taken time.
And what specifically do you think where you would have saved time mostly?
Yeah, I think I would know the process. Again, like I came into this, like picture not knowing anything about science. I didn't know anything about science at all. And I asked my old college friend, it's like, go start a drug company. Like I called my friends who did a bio major and was like, what is insulin? And then I called my friends who were lawyers and was like, how do you make a nonprofit? Right. And so like all these different, like, there's just so much knowledge, like baseline knowledge. How do you do taxes? How do you incorporate? How do you apply for nonprofit status? How do you create a business plan? What does the financial model look like? Okay,
Yeah, a
so you
lot of
want to do
questions.
drug development. Who does this kind of drug development? Right? Like drug development in and of itself has like a bunch of different branches. So it's like, who does this kind of drug development?
Yeah.
What is the term? Like I had to learn a whole new vocabulary, right? Like I need to know what a plasmid is. I need to know what insulin and E. coli and reverse phase cleaving steps and like FDA
Wow.
approvals and like
Which tied back to your original point of really sitting with yourself for 5 or 6 months and asking yourself, was this something that I wanted to do? And I was doing for other reasons, right? That would probably or potentially fall apart if I'm no longer in this relationship or no longer in this mindset. So you clearly did the work. And I love that, Eric, because you point out something that I think a lot of founders don't take seriously on the front end, or they allow the enthusiasm or their passion for that particular opportunity to overwhelm them in a way that pushes them past that point of introspection, right?
Yeah.
So they never really look deeply or think deeply about whether or not this is something they really want to commit to. And then all of a sudden, like you, the year 3, year 4, they look up and find themselves like, oh, this is real. I need to know all of this stuff, right? And they didn't commit to learning all the things that you learned, making all the relationships happen. And that's when it comes grinding to a halt, right? And that's usually when, as a consultant, I get a call, right, saying, hey, I've got this great idea. I've got a lot of momentum, but I've taken it as far as I can go, which to me sometimes is code word for what you're saying, Eric, which is I didn't do the homework, or I really just realized recently that I'm not as passionate about this idea as I was 4 or 5 years ago. And look, grinding on something that you're not making any money on, that you're getting a lot of doors slammed in your face on, that you're not finding a lot of success on early on, can push people to the mindset of, well, maybe I wasn't really committed to it like I thought it was. So as we get ready to kind of wrap up the show in your advice, give our audience and our founders some advice on that perseverance, right? And what it takes to really push through. Because I'm sure you had them, Eric, those moments where you're like, is this worth it? Like, what am I doing here, right? Talk to our audience about how you find inspiration in those moments. How do you push past that initial kind of like, oh man, I don't know if I want to still keep pushing this block over here.
I think I don't know if this is exactly advice, but there are tons of points of burnout, right, that come along the way. And there's all this nervousness. Again, we talked about LinkedIn early on, like everyone's doing so well on LinkedIn and like everyone's companies are amazing and like you raised money or whatever it is. But like early on, we tried to do like social media a lot. And I was always nervous, like, oh, we have to post anything in a few weeks because like nothing's happening because I'm just meeting with people and they're telling me things that's not really like, today I learned is not what our Project Insulin social media should be about.
Right.
And at some point, my partner was like, Eric, no one cares. Nobody cares. Like nobody is watching what you do every single day. Like nobody cares that yesterday you just like sat in front of the TV and just ate ice cream. Like nobody is watching every single day. And so like, yeah, we didn't raise enough money last month. Who cares? Like nobody knows. Like nobody cares. Nobody cares. I think like, again, it's not like I don't think people care all the time, right? Like every day I'm like, oh my gosh, this one person messaged me from, Oklahoma saying, thank you for the work that you're doing. And then like the weight of the whole country is on my shoulders. That's like how irrational I get. But like coming back to that idea that nobody cares, like people are excited for you, but nobody is like actively rooting for your downfall on a day-to-day basis. And nobody is watching close enough to say that like, oh, you haven't posted in 3 days. Like, everything okay at Project Insulin. And it's like, yeah, nobody cares. People just want to help you. Like people generally are supportive and they want to help. And again,
I love that advice.
Right? Like
I love that advice.
Just ask. That's the simplest version of the advice. Yeah.
No, and Eric, I love the earlier part of the advice where you said, look, you could go on LinkedIn and follow 100 people, and 99 of those people that you follow and will post something that will make you believe that everything is going right with their business. But what I tell people all the time about LinkedIn, LinkedIn is like a train station. It's like going to Penn Station in New York and just standing and watching all the people headed to their various connections and trains. Penn Station is like LinkedIn is like a party. And so know that even people who are posting great news are posting it because they're splashing the water up in some attempt to get attention for something else they need. And another way, those of us who are fully funded, fully employed, and fully engaged are not posting actively on LinkedIn. Yeah. So whenever you get paranoid, like, man, everybody's doing so well and I'm not, and look, no, those fools who are posting on LinkedIn profusely are posting because they are not where they want to be. Even though they look like they're somewhere you are, they aren't where they want to be, right? So never lose sight of that. People always think like, oh, LinkedIn, everybody's doing so well. No, you're at Penn Station. You're seeing some people who are headed up the elevator into a great situation, and you're seeing some people who are headed down, right? And that's when they get on LinkedIn. When you're going through change, when you need something, you find your way on the LinkedIn to be like, hey, everybody, I'm Dana. I'm back again. I know y'all hadn't heard from me in a while, but what happened was, right? Like that a lot of times is what LinkedIn is. And I think people, to your point, they get too caught up and too introspective and thinking that everybody's watching them, right? And like you said, nobody's watching you. Nobody's paying that much attention. Maybe a couple of your haters are, but for the rest of it, your supporters, we never even see the negative stuff. We didn't even realize we did post last week. Because guess what? Right. We were positively minded our own business until we stumbled across your last post anyway. Right.
Yeah. And like, to be clear here, like celebrate your wins, like
celebrate them.
Lick your wounds when something bad happens. Like, it happens. It's fine. Like you're allowed to not do well all the time. Like it's taken 4 years because we haven't been perfect. And like, that's okay. Right. Like things happen over time. And like, I celebrate such silly things. We had our first board meeting ever 4 years ago, and I bought a bottle of champagne. I don't drink champagne, but I bought one because I wanted to pop it. I just wanted to pop a bottle of champagne. It was a $7 bottle. It sits on my desk. Like I have it. I have the cork and everything because that was important to me. Does anyone else care? No. When we got the letter for our nonprofit status, I had my partner come with me to the mailbox so that she could take a picture of me holding the letter because I wanted to document it.
I love that. I love that.
But like, again, nobody cares. And that's okay. It's fine. Like when you ask if you need help and you want help, people care and they're willing to help you. But like, as far as your business is concerned, if you don't show something, people aren't like, oh my God, how dare you not share that? Whatever happened.
I love it. Listen, Eric, you have dropped a lot of science on today's interview, and I want to make sure that in the spirit of the show, I always like to end the show by making sure, number one, people know where to find you, how to follow you, how to support Project Insulin. But you specifically also want to end with one additional thing there, which is, what is your next big introduction or networking opportunity? Who do you need to meet that might be listening to the show, or somebody could introduce you to the right connections? So what are some of the key connections or the key partnerships you're looking to make before we get out of here?
Yeah, no, thank you. I appreciate that. Key partnerships and connections. If you know anyone who cares about health equity, passionate about it from a funding perspective, but from a nonprofit funding perspective, that's like the hard part. Please send them our way. Like I said, we're raising $750,000 to $1 million to get to that next phase of drug development. That includes hiring another person, an operations person, to oversee everything, but also to get that drug development done. Again, we're building the boat as we're sailing it, and so we need that operations person on.
And what does that ideal operations person look like for you, Eric?
Oh, probably some mix of, healthcare, life sciences, but also product management. We haven't really sat down and thought it too thoroughly yet because we don't have the funding, so there's no like job description. But we've like placed a few people we know that were like, that person would be perfect for this position to kind of like be the person who oversees operations, like budgets and timelines and managing the sciences and the fundraising, right? Like it's a bit of a nuanced, it's a double hat, kind of double duty there. So yeah, if you know anyone who can help with fundraising, that would be amazing, obviously. But more importantly, like volunteers. If you are in marketing, PR, communications, if you are in operations and are willing to give us a few hours of HubSpot help to help us automate some things, that would be really, truly appreciated. And then finally, if you care about what we're doing, if this struck a chord to you at all, and you're willing to host an event, whether that's a bingo night, a bowling night, a walk, or whatever kind of events, we're always open to ideas. Events are the best way for us to spread the word to the people that you know and people that you know who care about this. So check us out at projectinsulin.org or send me an email, emoyal@projectinsulin.org. Let us know if you're willing and able to support, and we're happy to bring you on.
Thank you, Eric, for that. And again, for our audience, we will have all of that information available in the show notes as well as on our website. So if you go out to www.thebrandblueprint.biz, you will be able to find Eric's page. On that page will be links to his website, to Project Insulin. And definitely, I implore anybody and everybody who is concerned about the overall health of America, this is a much needed service, because I and many other families who have been affected by diabetes know how much of a financial impact and potential burden this could be on people who are not financially well enough off to afford both the insurance to cover this, and then obviously the copay, or even if you don't have insurance, the full cost of insulin. And this is something that is so widespread and prevalent. I would find it hard to believe that many listening to this podcast don't know somebody who's not affected by diabetes. So thanks again, Eric, for coming on the Brand Blueprint, man. We so appreciate you. And I am not playing. We're going to have a part 2 and a part 3. We got to go back, learn more about this bike ride and this other initiative that you've spent so much time and energy focused on bringing awareness to. And then I just want to get to know you a little bit better. I think our audience will find your story more interesting as we continue to talk. So thanks again for coming on. And for our audience, thank you for tuning in to another great episode of the Brand Blueprint. Remember, follow, share our content. If you don't do one of those things, I tend to think you might be a hater. You don't want to be a hater. So at least share, follow this information, share this information from our interview today with those of people in your circle who could be of real use and assistance to Eric's mission. Thanks again for joining in. Have a great one, and tune in next time to the Great Brand Blueprint.
Thank you, Dana. Appreciate it.
Thanks again. Thanks for joining us on the Brand Blueprint journey. Make sure to follow us on all of our social media platforms to stay updated. Watch the full episodes on our YouTube channel for an in-depth experience. Don't forget to subscribe to our website at thebrandblueprint.biz for exclusive content and materials. We're everywhere you need us to be.